Hello, and thank you for tuning in to our live Q&A, where we'll be discussing your questions and concerns about kids going back to school and COVID-19. Today, I'm joined by pediatrician Dr. Marguerite Oding and infectious disease specialist Melanie Wellington. Please submit any questions or concerns you have now in the comments, and we'll get to as many of those as we can throughout our discussion. Thank you so much for joining us today, Dr. Oding and Wellington.
Nice to be here. Thanks.
Thank you for having me.
Of course. So Dr. Wellington, we're going to start with you today. How can parents talk to their children about this virus and taking precautions?
It's not so easy when most of the answers are, we don't know yet. I actually also have a daughter, and so I've experienced this several times. But I think that things to keep in mind are the same things most of the time we talk to kids about anything. Keep it simple, keep it at their level. Be sure that they know a little bit about how it's passed from person to person. And also make sure they know that if they get it or if somebody they know gets it, it's not because they did anything wrong. It's a virus, and it is very, as my daughter puts it, sneaky. But kids will definitely imagine the situation to be worse than it actually is. They just default to that pretty much in general. So the most important part of all of it is just talk to your kids.
Great. Do you guys have any specific advice about what are the most important precautions to talk to kids about? I mean, we know hand hygiene is probably the most important, or at least one of the most important. So what are the things that absolutely parents can try to be teaching their kids to just make a part of their lives right now?
I think probably the mask is the biggest issue, right? We've been trying to teach our kids how to wash their hands for a while, but the mask is new. And again, it's age dependent. When, we sat down with a spray bottle and a mask and showed my daughter how if you spray, the droplets go everywhere. And if you put a mask in front of the spray bottle, the droplets don't go everywhere. And that kind of thing. Just the importance of the mask, kind of thinking about when they need to wear it, which is a lot of the time, when it's okay to not wear it. And also, I think one thing that kind of stumps some of the kids is, why do some people not wear a mask? There are people who have a medical condition and shouldn't be wearing a mask. So they need to know that if they see someone without a mask, it's okay. It's not time to panic. I think those are probably the biggest rules around masks. And again, just a brief mention about how it's transmitted. So things to say are that when anybody talks or breathes all the time, little tiny droplets you can't see come out of the mouth and nose. And when somebody has the virus, when those little droplets come out, they can actually be picked up by somebody else. Something more advanced or less advanced, depending on the kid's age. But if you give them the sense that sort of things coming out of the mouth and nose can travel through the air to other people, that will help them really kind of understand why we're asking them to do all these crazy things.
I think one thing to keep in mind is that part of the explanation is talking to the kids, but modeling is also very important. Yeah. So we're really teaching our kids when we wear the mask and when we wash our hands and when we social distance. And so the words that you give are only part of the story. The other thing I would say is, as Dr. Wellington said, you're speaking to them at their level. A big part of that is listening. So what are your questions? What do you want to know about this? Because what as adults, what we think is important may not be what the kid really wants to know. So yeah, giving them time to vent and ask you questions is really important.
Yeah, those are great reminders. Thank you both. Dr. Oding, what are some of the things that would be considered risky at school for kids? And what are some of the things we really don't need to worry about?
So risk, is a spectrum, and risk comes from several places. So being around a lot of people. So activities that the children can be in that are in smaller groups are relatively less risky. Activities where they are not receiving droplets from other people. So if they can wear a mask, and then anything that they can do where they can wash their hands and keep their hands away from their face. So I'm, outside for right now, outside is a great option. So I feel like of all the things that kids can do at school, recess is probably a less risky activity. because of the way droplets are spread, if you cough, if you talk loudly, if you sneeze or cough, if you play a musical instrument and you're blowing hard, those activities are relatively more risky. So I know the schools are accommodating that. They're changing the music programs up a little bit and trying to keep sick people at home, all those things. So activities where you minimize the risk. Sports activities and PE, the kids are going to be wearing masks even during those activities because there's increased droplet production during those activities. Is there anything that you don't have to worry about? I mean, everything has a little risk anytime you're around another person, but I think if we try to stay calm about it, wear the masks, wash the hands, social distance, and just remember that outside is awesome right now.
And there's also a time component. So, I think this was early in the outbreak. We all had to come to terms with this when we were at the grocery store. That when you are briefly walking past another person, even if you're closer than 6 feet, even if that other person doesn't have a mask on, if it's just sort of like passing, that isn't really very risky. Again, like Marguerite said, that levels of risk, right? Nothing is 100% safe. Nothing in life is 100% safe. But a very low risk thing is when you sort of are passing somebody and you go your separate ways. If you're on top of somebody for a long period of time, well, or even just really close in a cluster of people for a long period of time, that's more risky.
Great. That my daughter's not even in school yet, and that gives me peace of mind. So thank you guys so much for those tidbits. Dr. Oding, do you have any tips for parents who are in teacher mode this year? Those parents whose kids are at school with them and they're helping them guide them through online schooling. Any tips?
So, number one, I'm not an educator, so I would say to definitely take advantage of the resources that your district is offering. The Iowa City schools, the teachers and guidance counselors are there. They're working, they're available to help if you're having questions about how to actually help your child learn. But from a pediatrician perspective, it's more about things you can do with lifestyle at home. So the biggest thing I would suggest is establishing a routine. When your kids are in real school or in-person school, you have a very structured routine. Most families do. And we've really seen that slip away during COVID. It's almost been like, for a lot of people, like they were on some extended spring break holiday or something. So I would recommend getting back into a school type routine. Get up at the same time every day, get dressed, eat your breakfast, do your school, do your chores, have your playtime, bedtime at a regular hour.
And don't forget to take breaks.
Yes.
I think our adult approach is, here are the list of things I must accomplish today. I will accomplish them and then I will have fun, right? But recess is in the middle of the day at school for a reason.
Mm-hmm. And my understanding is those breaks are built in by at least the Iowa City schools for their online program, their scheduling breaks. Another thing you can do is to be an active participant. So know what assignments are due, know when your child is supposed to be online for their in-person instruction or their live in-person instruction. Help them with their homework. It's going to take much more effort, of course, on the part of parents this year. Limit media other than the media that's required for school, because these kids are, the Academy of Pediatrics recommends less than 2 hours on screens every day. We can't do that right now because school is on screens. And so we need to make sure we're limiting the rest of the screen time, get the kids outdoors to play, get them doing other activities. And then in general, maintaining a healthy lifestyle. So continue to eat nutritious foods, limit snacks, physical activity, plenty of sleep, the things that really part of the routine that a lot of us have let go.
That's a great reminder too. I appreciate you guys bringing these up because, I've got a 3-year-old that's home with me most days now, and we're doing preschool stuff, but just remembering that we all need that mental break. and that physical outlet. And it's a great reminder for, I'm sure, parents of all ages to hear that. And so on that same topic, I want to, a lot of parents, and I included, are wondering, will children be affected socially, emotionally, or academically by doing virtual school this year? Will they fall behind their peers? I mean, what do we know about that? And Dr. Wellington, we'll start with you.
This is the big, tough issue of the hour. And, the answer is that there are going to be kids who are going to have trouble with the system. And some of them are kids who can focus their attention easier in person than on the screen. That's a very common problem. Kids who don't speak English, right? Online learning is real tough for them. And there's a tremendous amount of mental health risks to kids that are increased with the lack of socialization and the lack of the routines. So there are a lot of risks to having to sort of move to this new virtual learning model. Will they fall behind other kids? Comparisons are, what do they say? That comparisons are the thief of joy. But I think that all of the districts are working extremely hard to make sure the kids get as much education as safely as possible. And like we said, there is no safe and there is no perfect in terms of education either. So, it's possible that we'll see even more disparity than we did before. There's been a lot of suggestion, especially that the kids who have academic disadvantages to start with are going to have an even harder road this year than others. So we need to make sure that we're really encouraging all of our systems to address those disparities, to make sure there's resources for equity. But in general, I wouldn't worry too much about how much your kid will accomplish this year, as much as I would just worry about, again, just keeping things moving for them, keeping the routines, and really encouraging them to find new ways to learn.
I agree. I think it's a pretty individual thing. And I would encourage parents who have any concerns about their child to contact either their pediatrician or the guidance counselor or the teacher at school to see what kind of accommodations can be made. The teachers won't have their finger on the pulse of the children quite as well while we're remote. So things that you typically pick up on during the school year, they may not pick up on online, and they're going to need parents to be telling them, what the problem is so they can remediate it.
Yeah. So a lot of people are wondering if their kids can play with other kids outside of school, especially if, let's say your child is doing all virtual school, but they've got a really good friend on their block. That could be really good for their mental and physical health. Is that something that's safe to do? And are there certain precautions that people should take if they want to allow their children to play with others outside of school? And Dr. Oding, we'll start with you for this one.
Yeah. So again, we're talking about spectrum of risk. So the safest thing is if your kid doesn't see anybody outside of the family, but that's not going to fly for a lot of kids. And so limiting the number of kids that your child is in contact with outside of the home is, an intermediate risk, and one that a lot of people are willing to take. And I would say, try to pick a couple of friends, not a whole lot of friends, that the parents, and the parents are taking precautions similar to you. You have a similar risk assessment of the situation. Neither family has anybody, really high risk living with them, or both families have somebody really high risk living with them, so that your risks are similar. And that's the child or the few children that your kids get to play with. But yeah, I think kids do need some social interaction.
Absolutely. And remember, just with everything, there's balancing risks. Having your child have no social interaction is also a major risk for their mental health and physical health because they don't move around as much. But the other thing to remember is sort of level of safety here. It's for the kids, it's really not that much of a risk. For otherwise healthy kids, the chances of having even what we call moderate disease from the virus are really low. The chances of a kid being sick or hospitalized are extremely low. And even kids who have medical problems, if those problems are mild to moderate, most of those kids are completely fine with this virus. Most kids who get it have a couple days where they don't feel like eating. Maybe they have a head cold. Maybe they have a day of fever. But really, the risk to the child is pretty low as far as what disease would happen. But like Marguerite said, you have to think about everybody who's in your bubble, right? And so if you're thinking about joining your bubble with somebody else's bubble, you have to look at all the people and who is at risk and how can we take measures to make sure that our highest risk people are protected.
Yeah. So what is the aside from knowing, that the other family is taking, similar precautions or whatever it is, are there any other tips we would give to people maybe still wearing masks, avoiding going inside while playing? Are those the main ones?
Yeah, while we can. I mean, the masks we can do even later, although, little kids like your 3-year-old may find it a little bit of a challenge to play normally with the mask on. So, but you're trying, I bet. And as long as we can stay outside, have them play outside, we'll have to make different risk assessments as the winter comes on. But I think, even winter is sort of relative. My sister lives in Montreal and their kids go outside for recess until it's 20 below zero. So, if we bundle our kids up, we can probably even send them out this winter. So.
Great. Thank you guys for those tips and advice for parents. So Dr. Wellington, if a child in my child's class tests positive for COVID-19, should I go get my child tested even if they aren't showing symptoms? What should I be worried about?
So a lot of it depends on what kind of interaction your child and the child who is sick had. And one of the great things that schools have been doing is they've been getting organized for starting back up in whichever, at all the models, is working out mechanisms for figuring out who has been exposed at school. So the schools will tell you, or the health department, or both, right? And if someone says your child had a high risk exposure or had close contact with someone who's positive, there's going to be a lot of things that have to happen. The biggest one of which would be that your child would have to go into quarantine or not interact with anybody if the exposure was a high risk for infection. But there are plenty of times where the interaction may have been brief. They may have been on opposite sides of the classroom for 45 minutes and then never saw each other again, et cetera, where there's an exposure because they were in the same room, but the risk of that person getting your child sick is pretty low. So my best advice with that is just sort of check in with the school, listen carefully. If you have special questions or different situations, ask them about that. But both the schools and the county health department are really great resources. And they can help through the decisions about whether or not to quarantine, whether or not to test, that kind of thing.
Great. Thank you.
One thing I think parents should know is that, at the beginning of this pandemic, there was a real shortage of tests. And so I know people were feeling like they wanted their child tested and just couldn't get it done. And that's not the case anymore in Johnson County. We can test kids that need to be tested. So if the school nurse or the health department tells you that your child doesn't need a test, you don't need to worry that it's just because there aren't tests available. There are tests. So if they need a test, they'll get a test.
Yeah. And that's really, actually, if they say you don't need a test, that's great news, right? Yeah. Because that means that there was really not a significant risk. And the schools are very careful about this. If there's any significant risk that your child was infected, you will know.
Great. Thanks for that peace of mind too. Dr. Wellington, if a sibling is sick and parents aren't sure what they have yet, should they keep all the kids in the family home from school and other activities until they know what the sibling has?
Yeah, I mean, this is a tough one, right? Because it's hard to say, here's my perfectly healthy child, and they just happen to live with this person. And some of it's going to come down to judgment call. But my general advice is, if you're not sure, keep everybody at home until you've had a chance to assess the situation. The symptoms of COVID in children are really mild. They can be sore throat and nothing else, headache and nothing else, sort of a a new head cold for a few days, and then so if you have a kid who's sick at home, and it turns out that kid has COVID, then the other kids in your house have been exposed and may also have it. In fact, they may both have gotten it from somebody that they contacted together. And since many people with COVID don't have symptoms at all, if one of your kids has it, you should just assume the rest of them could very well have it. And if you send them to school, then you may be exposing everybody at school. So there are definitely times when the one kid has something that's completely unrelated to COVID, when you should send all the healthy kids to school. But most of the time, if there's any possibility that they have really that they have COVID, call your doctor, call your primary care provider, call the school if you need advice from the school, but keep everybody at home, and basically not just the other kids, right? You yourself should stay at home. Everybody in that household should stay sort of isolate themselves at home until they get it figured out.
And, for the parents' benefit, the child's benefit, and the school's benefit, the best thing to do is to try to get tested as soon as possible. The University of Iowa system has turnaround in less than 12 hours, so you can easily get your results back by the next day. Most kids are going to be negative. Everybody can go back to school. Parents can go back to work. If you don't get tested, with transmission rates like we have right now in Johnson County, it's very likely that the health department is going to consider your child positive, and you're going to get the 10-day or the 14-day quarantine, and the 10-day isolation for the kid that actually has symptoms, and you're going to be out of work for a long time. So even though the test is not fun, it is not horrible. And I would really encourage people to get children with symptoms tested, even if they seem mild.
Absolutely. And even if you're not already a patient of our system, there is a mechanism, there's a call-in number on the website that you can actually call and become part of our system, for the purposes of this evaluation.
Great. So if you're just joining us on this in this broadcast, I'm here with Dr. Marguerite Oetting and Dr. Melanie Wellington answering your questions about kids and COVID-19. So leave any questions or concerns you have in the comments below, and we'll get to as many of them as we can in the time that we have left. So I want to get to some of the questions we've had submitted to us online. Dodie is wondering if you can contract the COVID-19 virus by touching things. If you guys remember, we were all very worried about that at the beginning, and then we've seemed not to talk about it as much. Is that still a concern?
It is, but it's not as big of a concern as it used to be. You're right. If a virus is on the surface and you touch it, and then you touch your eyes or your nose or your mouth, you can transmit the virus to yourself. And certainly some proportion of the time that happens. We were initially very, very worried about that, because viruses can actually, this particular virus can actually stay active even when it's on stuff and not in a person for a long time. The good news is it doesn't seem to come off of stuff onto you very easily. So when we look at who's actually getting it and how did they get it, very few people are getting it from that touch transmission. However, it does happen, and it's just another excellent time to remind everybody about hand hygiene and cleaning what we call high-touch surfaces in your house as often as possible.
And the schools, at least the Iowa City Community School District, and I assume others, have extensive disinfecting and sanitizing plans in place. So the schools will be cleaned probably better than my home.
I can tell you my home's never been cleaner than it has been.
Exactly. Actually, that brings up another point, right? When I said as often as possible, there is going too far, right? Yeah. So clean as often as you need to be comfortable. But if anybody's skin or anybody's objects or whatever are becoming degraded from all the cleaning, then that's probably too much. A reasonable approach would be, depends on the object and who's touching it and all that sort of things. But I wouldn't, for your house, right, I wouldn't be cleaning that more than once a day. And even once a day is probably too much for some of the surfaces. You just have to kind of use your judgment.
So Molly is wondering about the hybrid learning models where students are online some days and in school some days. Can you guys explain how that hybrid model can decrease the risk and just kind of discuss that in general? And Dr. Oetting, would you like to start?
Sure. So the The idea with the hybrid models is that they're starting with only half of the kids in the school building at a time. And, we said the more people you're exposed to, the higher your risk of contracting the virus. So the fewer kids that are in the school, the fewer kids your child is exposed to. In addition, because there are fewer kids in the building, there's more room to spread out. And so, lunchrooms are less crowded, hallways are less crowded, bathrooms are less crowded.
School buses
are much less crowded. So that's the theory behind the hybrid model, is just decreasing the amount of exposure.
Great. So Craig has a question about the difference in risk for young children compared to older kids and adults. So how much do we know about this, and are there differences in the risks for the two age groups?
Yeah, so there's a couple of differences. I don't know if that makes any sense. Young kids, anybody of any age can get COVID, and there's some argument about whether young kids get it as easily as other people, but I'm sort of going to go on the assumption that unless we have more data, everybody gets it just as well as everybody else. What happens, though, is the younger the child is, the less likely they are to have disease. So they get infected with the virus, but they don't get the problems that we see in older adults. So like I said, on the University of Iowa website, we maintain sort of an up-to-date list of the hospital numbers. And for the entire outbreak, we've had 26 kids total who've been in the hospital. And a good portion of those were in the hospital for something else and had COVID or had the virus. So, the younger you are, and certainly kids under the age of 20 are really low risk for having any problems whatsoever when they do get infected. And then the other low risk that is actually very fortunate and is going to help us as we sort of try to get things going back to school is that kids under the age of somewhere in the 10 to 12 range, certainly the elementary age kids, are much less likely to transmit it to each other or to other adults. So what that means is that if you and your kid are both infected, right, you, the adult, is going to give it to other people a lot more than your kid will. And that has to do with some weird biology, some of which we understand and some we don't. But it actually makes it a lot easier for schools because it means that when our kids are at school, there's less risk of them getting the teacher sick, and there's less risk of getting each other sick than it would be if all the adults were at the school.
And this is sort of a surprising aspect of this virus, because we usually think of young children as the major infectors of everybody else. I mean, anyone who has a child in daycare knows that you get sick from your child
constantly.
For most viruses. And influenza, young children are a major spreader of the influenza virus every year. So we really have to shift our thinking about coronavirus, because I think at the beginning, even for me, it was really hard to wrap my head around the fact that these kids were not spreading the virus. We're not going to get it from them in the same way we're going to get it from other adults. The schools are recognizing this as well, and they've actually put a lot more limits on the adult staff in the schools than they are going to be putting on the children. So, adults can't eat together. They can't have group meetings. All the planning sessions will be by Zoom and things like that. So it's a real shift in our thinking.
And while we're talking about kids and the fact that they do or don't get sick from COVID, I see a question came up. Sorry to jump, Elizabeth, but I see that Anne had asked about the long-term effects of COVID, and it's sort of on topic. So the kids themselves are much less likely to get sick at all. When they do get sick, the symptoms will be like a mild cold, and they'll get better. There are occasionally, very rarely, but it gets on the news a lot because it's scary, okay? But it is very rare. There's what's called multi-system inflammatory disorder of children associated with COVID or something like that. It's MIS-C. You hear about it a ton. And that's where kids have an exuberant and overly strong immune response, and they get a lot of inflammation. But it's really, really rare. And what we're now seeing a lot more news about is, and mostly studies in adults, about people and how when they're sick with COVID, even if they're not needing to go to the hospital or anything, how it affects your heart, and also how you can have a long-term COVID. But again, that's really something where the impact is in adults. Almost all viruses, actually, if you look carefully, while somebody's sick with a virus, their heart doesn't work quite as well as it does when they're healthy. It's another one of those things that you try not to think about too much because viruses are a part of our life and we can't get around that. So I suspect that as we get more and more knowledge about long-term impact on children and even maybe long-term impact on adults, a lot of what we're seeing in these what we call acute or immediate changes in heart function are part of being sick with a virus and unlikely to have a long-term problem for the kids.
One thing that's come out fairly recently also is some concern about student athletes who, after they have COVID. And so the Iowa High School Athletic Association for boys and girls is going to be coming out with a statement, hopefully in the next week or two, guidance for physicians. But if your child has COVID and you want them to go back to athletics, I would encourage you to call your pediatrician first. It's very likely if they had anything other than the mildest of infections that they will get an EKG, which is a painless test of the heart rhythm, the electrical signals from the heart, before they are cleared to go back to sports.
Yes, and that what I was mentioning, that thing about what most viruses have a sort of temporary decrease in your heart function. It's usually of no consequence whatsoever, and it gets better and you go back. But if you have exceptional strain on your heart while your heart is, while you're sick, basically, that's when it can cause problems. Mm-hmm. And so that's why you hear about these things with the athletes, especially. While you're sick with a virus, you should do what your body tells you and rest and recover. And for our athletes, we want to just make sure that temporary problem is resolved before they go out there and go full force again.
And the thought is that it is going to resolve. So it's not like a permanent condition, right. But they just don't want kids out doing strenuous athletics when they might not be at full potential.
That's a great reminder for even adults, because I can't tell you the number of people I know who are like, I don't feel very well today, but yet they're going for a run. And it's good. Yeah. It's a good reminder. Your body needs that rest. Mm-hmm. And that's your body's way of saying, hey, don't push yourself. Yeah. So that's a great reminder for kids and adults, I think.
As with most things, your mother was right. When you're sick, you should get plenty of rest.
Oh, do you hear that, Mom? I'm pretty sure she's watching right now. So you were right. So Dr. Oding, for our hospital, at least for people who whose kids come to see our pediatricians, do they call their pediatricians if they have concerns about COVID with their kid, or do they need to go to urgent care? How does that work?
So the workflow is evolving a little bit, but at this point, I think the best thing to do is probably just call your pediatrician's office. The University of Iowa Pediatrics clinics, our nurses are happy to talk to any parent, and then we can order the testing if that's necessary. If the test is negative, we can see the child in clinic, but we would prefer to have a negative result before we see them in the clinic, because we're seeing newborns and other healthy children as well. Great.
Do either of you guys have tips for parents on how they can help their kids cope throughout this school year? It's been a weird year in general, but no matter what kind of school model kids are going through, this is new and can be scary. Do you have any advice for parents?
I would say give them time, listen to what they want to talk about, reassure them, stay calm, limit media, keep a routine, just the basics.
Yeah, and what you said earlier about role modeling is so important here. Doing that listening and then acknowledging it. Mm-hmm. So when my daughter's upset because blah 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 related to COVID, my first response is, yeah, it is really hard. Sometimes just acknowledging that this isn't the way it's supposed to be, this is harder than it has been. That can be a good place to start.
I think another good thing to remember, that families that I'm seeing coming in just for well checks and stuff, everybody's stress level, whether you appreciate it or not, is up several notches. And so it's a little harder for parents to be patient it's a little harder for kids to behave well.
Yeah.
It's a little harder for all of us to just live our lives. And I think we need to all give ourselves a little bit of slack. This is just a hard time. And like you said, acknowledging that to your kids is sometimes the biggest need they have.
Yeah, and some of the families I know that have done a really nice job with this have found a COVID thing. They don't call it COVID thing, but I know one family that has COVID game. So every night after dinner, because they're not all going 10 different directions, they'll take 15 minutes maybe and play a family game or whatever it is your family likes to do, right? The one thing we have right now is a little bit more at home time. Sometimes a lot more, right? So take a little bit of that time, right, and do something that you wouldn't have otherwise done, and just say, COVID is hard. It is a hard time. We're all stressed. There's all this other stuff we have to handle. Let's find one thing at least that we can come together as a family and take advantage of this time, or do now that we wouldn't normally do. Just to have one sort of, especially because it adds a routine. It adds time for talking and listening. Just pick something. Get together and do it.
One thing I've seen out in the community, one of my ways of coping is that I walk, and I've done a lot of walking. But I've also seen a lot of families out, the whole family, riding bikes together or walking together. And that's actually really a wonderful thing to see. So despite how difficult this is, there are a few silver linings. I had a dad in the other day with his infant for a well child check, and I asked him how he was coping, and he said, actually, this has been really amazing because he's staying home with his son, his infant son. And he said, I never would have done that. And it's actually been one of the greatest times of my life, that piece. Other pieces not so good, but that piece. And I thought, wow, that's really cool that, there are some silver linings, and that if you can try to find those, if there are any in your life, then that'll help your kids too.
Yeah, absolutely. Clinical psychologist at UI Hospitals and Clinics, Stacey Pollock, we just did a Facebook Live with her last week talking about how we can manage our mental health. And she said something that has stuck with me, which is hunt the good right now. Hunt the good in life, in your day, in your week, whatever it is. And that has changed just in a week. That's changed how I'm interacting with my daughter, because you're right. I'm up several levels. She's up several levels, and it can be really easy to butt heads. But when I hunt for the good in the day, or in her behavior, or in the things that she achieved, even though maybe it was kind of a rough day, you look at it differently and you end the day on a different note. And so between what you guys just said, that great advice and good reminders, and the reminder to hunt the good right now, I think we can sort of start to see the light at the end of the tunnel. Well, thank you both so much for sharing your expertise with us today. It was so valuable.
Thank you for having us.
Absolutely.
Of course. And thank you to everyone who tuned in. If you joined us after we started, please make sure to go back to the beginning, because there was so much great information provided throughout this entire broadcast. And stay tuned to our social media accounts and our website, uihd.org or uichildrens.org, for all the latest updates on COVID-19 as we have them. Lastly, remember to wash your hands, wear a face mask and keep a safe distance from others, and take care of your physical and mental health during this time. Thank you so much for watching.